Hello, everybody. This is Gary. Today is Saturday, April 16th, 2022. It is 11:37 a.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. An update on my symptoms. My paranoia is pretty bad today. I think people are following me, watching me, judging me, spying on me, following me. I went out yesterday to the pharmacy. I felt that I was being watched at the bus station and judged like I was doing something wrong. I felt like I was being watched. I was sitting on the bench in the regional transit center, inside, indoors, waiting for my bus. A person came down and sat next to me, and then she started talking to one of her friends, and he asked her, was I a friend of hers, because I was sitting very close to her. But I'm not the one who sat down next to her. She sat down next to me, and then he started to proceed to act like I was trying to hint on her or something, or try to get her phone number or something, and he got upset with me. And I go, I'm just sitting here. She sat down next to me and I didn't say a word to her. I don't know this person. I have no desire to know this person. And yet they were judging me like I'm the one who did something wrong when I did absolutely nothing. Um, I often get people getting into my personal space very rudely, and that makes my paranoia get worse. It makes me feel like I'm being watched, followed, spied on, like I'm doing something wrong when I'm not doing anything at all. Um, Maybe I just have a guilty conscience, I don't know. But my paranoia is pretty intense today. My anger is pretty intense today. My anxiety levels are very high. My depression is very severe. My auditory hallucinations are very loud. They get louder when I'm under mental stress, and my paranoia and my delusions are very strong. It's hard for me sometimes to determine what is real and what isn't real, and if people are intending to harm me, whether that harm is mental, physical, or emotional. Um, I don't know when people are trying to intimidate me, or I'm just imagining they're trying to intimidate me or follow me. It's very hard sometimes for me to perceive reality, and even if I perceive reality correctly, like maybe somebody really is judging me or spying on me, it's hard for me to deal with that reality in a calm and rational manner. Um, I'm just very angry, very paranoid today. High levels high levels of anxiety, severe depression, um, very intense auditory hallucinations. Um, so I'm feeling very, very agitated mentally. Um, I don't like people getting into my personal space. I don't like people accusing me of things I didn't do. I don't like being spied on. I don't like being followed. I don't like being judged when I didn't do anything wrong, and I'm not doing anything wrong. And on top of all that, I'm still facing physical problems. I'm having a lot of physical body pain in my legs today, especially my right knee. I have a torn meniscus in my right knee, and I still have to walk on it because I still have to go food shopping. I still have to clean my apartment. I still have to do my laundry. I still have to pay my bills. I still have to physically move around. I'm scheduled for surgery on April 29th this month. Today's the 16th, so it's about 2 weeks away. And in the meantime, I still have to do all the things I normally do because I have no one to help me. I'm very agitated. My right knee's in a lot of pain. I'm trying to stick to my daily schedule of physical therapy exercises for the rest of my body, which I just completed. I'm doing this video as part of my daily schedule. I didn't do anything yesterday because I didn't feel very motivated to do anything. Lack of motivation is called a negative symptom, and it's part of schizophrenia. Often when I do stick to my daily schedule, I have to force myself through it. It's very difficult when I don't have any motivation to do anything at all, including sticking to my daily schedule. So I'm scheduled for surgery to remove the damaged meniscus out of my right knee and remove any floating cartilage that's loose and repair part of the meniscus that's capable of being repaired. Most of it's just going to be removed. So I'm doing the best I can to cope with what I got going on, which is an awful lot. I don't feel very good today. I'm in a lot of physical pain. And I just wish the surgery would come and get done and over with. I'm finding it very difficult to cope. I don't want to go to the psychiatric emergency room. I haven't been to the psychiatric emergency room since October 30th of last year. So it's been a while. I've been doing well enough where I don't have to go to the psychiatric emergency room, and I would prefer not to go. It's overcrowded. Sometimes it's violent. It's noisy. It's confusion. It's chaotic. The staff are overwhelmed by the number of people that go into the psychiatric emergency room, and you might wait up for more than 24 hours to see a psychiatrist, and legally, once you're in the psychiatric emergency room, whether you're there voluntarily or involuntarily, you can't leave once you're there until you talk to a psychiatrist, and that can take hours and even days. And you're basically sleeping on a chair or a couch because there are no beds in the psychiatric emergency room. It's a very chaotic place, and it really doesn't solve much of anything. I've heard news stories of people going to the psychiatric emergency room and then being discharged, and they end up committing suicide or some sort of violent act. So going to the psychiatric emergency room doesn't really accomplish much most of the time. Psychiatrists can't read people's minds. They can't know when they're potentially violent or suicidal. I myself am not violent. I'm not suicidal. I'm not stupid. I don't want to go to jail. I don't want to die. And going to the psychiatric emergency room is something you would only do if you're suicidal or violent. I'm not suicidal or violent. But I'm having a tough time coping. I'm struggling a lot. I'm not looking forward towards surgery. I've already had surgery twice in the past 14 months on my urinary bladder and on my prostate. Both times after surgery, within 7 to 10 days, I ended up in the psychiatric emergency room. I don't know what it is about surgery that triggers me, but it's very uncomfortable, regardless of whether or not I have to spend the night in the hospital for surgery. Surgery is a very stressful thing, and preparing for surgery is a very stressful thing. And it'll be stressful after surgery because I'll be walking around on crutches for a couple of days, unable to do anything for myself, like grocery shopping, cleaning my apartment. So I'm gonna have to make sure I got all my meds, all the food that I need, that my apartment is clean, my laundry is done, everything's taken care of. I have all my necessary medicines stockpiled, because there's gonna be a few days where I can't do anything after surgery. I have no one to help me. I'm on my own on this. I mean, I appreciate the nurses and the doctors and the psychotherapists and the psychiatrist. They give me treatment, but I don't have the money for a home health aide to help me after surgery, so I'm basically alone. Once I'm out of surgery, once I go home, I'm on my own. That's basically what I've been told. And I don't have any friends to help me with these things. I'm not a very sociable person. I don't have any friends. So that's all for now.